Managing polypharmacy in older adults represents a critical challenge in contemporary healthcare practice. Polypharmacy is defined as the concurrent use of multiple medications by a single patient. While definitions vary, polypharmacy typically refers to the use of 5 or more medications simultaneously. This presentation will focus on identifying risks, applying clinical criteria, and implementing systematic approaches to medication optimization. Patient safety and collaborative decision-making remain the primary objectives. Polypharmacy affects approximately 67% of adults aged 65 and older in community settings. The prevalence increases significantly in institutional care settings and among patients with multiple comorbidities. Associated risks include increased adverse drug reactions, drug-drug interactions, and medication non-adherence. These complications result in increased hospitalizations, emergency department visits, and healthcare costs. Drug-drug interactions occur in approximately 40% of older adults taking 5 or more medications. Medication errors increase exponentially with each additional medication prescribed. Cognitive impairment and functional decline represent additional risk factors that complicate medication management. Age-related physiological changes alter drug metabolism and increase susceptibility to adverse effects. Decreased renal and hepatic function require careful consideration when prescribing and monitoring medications. Recognition of these risks necessitates systematic approaches to medication evaluation and optimization.
The Beers criteria provide evidence-based guidelines for identifying potentially inappropriate medications in older adults. These criteria categorize medications based on risk-benefit ratios specific to the geriatric population. The first category identifies medications that should generally be avoided in older adults regardless of diagnosis. Examples include certain antihistamines, benzodiazepines, and anticholinergic medications with high-risk profiles. The second category addresses medications requiring dose adjustments based on kidney function. The third category identifies drug disease interactions where medications may exacerbate existing conditions. For example, non-steroidal anti-inflammatory drugs in patients with heart failure or chronic kidney disease. Electronic health records increasingly incorporate Beers criteria alerts to support clinical decision-making. Implementation requires systematic review processes and multidisciplinary collaboration. Regular medication reconciliation provides opportunities to apply Beers criteria systematically. Clinical judgment remains essential, as the criteria provide guidance rather than absolute contraindications. Individual patient factors, preferences, and goals of care must inform final prescribing decisions. Successful implementation requires ongoing education and integration into routine clinical workflows. Medication review frameworks provide structured approaches to evaluate appropriateness, effectiveness, and safety of prescribed medications. The stop-start criteria offer explicit guidance for identifying potentially inappropriate prescribing and prescribing omissions. Stop criteria identify medications that should be stopped, while start criteria identify beneficial medications that should be initiated. Comprehensive medication review should assess indication, effectiveness, safety, and patient adherence for each medication. Deprescribing represents the planned and supervised process of dose reduction or discontinuation of inappropriate medications. The deprescribing process requires careful patient monitoring and gradual dose reduction to prevent withdrawal effects. Tapering schedules must be individualized based on medication half-life, patient factors, and withdrawal risk. Close monitoring during deprescribing identifies potential withdrawal symptoms or disease exacerbation. Documentation of medication effectiveness and adverse effects supports evidence-based deprescribing decisions. Family involvement enhances medication review success through improved monitoring and adherence support. Specialized medication therapy management services provide systematic approaches to complex polypharmacy cases. Technology integration supports systematic medication review through clinical decision support and automated alerts. Regular interdisciplinary communication ensures coordinated approaches to medication review and deprescribing. Quality improvement initiatives track medication review outcomes and identify opportunities for process enhancement.
Prescription cascades occur when adverse effects of one medication are misinterpreted as new medical conditions requiring additional treatment. Recognition requires systematic evaluation of temporal relationships between medication initiation and symptom onset. Common examples include diuretics causing incontinence treated with anticholinergics, or antipsychotics causing Parkinsonism treated with dopamine agonists. Prevention strategies include thorough medication history taking and systematic side effect assessment before prescribing additional medications. Clinical decision support systems can alert prescribers to potential cascade situations during the prescribing process. Interdisciplinary collaboration enhances cascade recognition through diverse clinical perspectives and expertise. Institutional policies and education programs support systematic approaches to cascade prevention and recognition. Patient education empowers individuals to recognize and report potential medication-related symptoms promptly. Technology integration facilitates cascade recognition through automated monitoring and alert systems.
Patient and caregiver engagement requires collaborative approaches that respect individual preferences, values, and treatment goals. Effective communication utilizes plain language, visual aids, and culturally appropriate materials to enhance understanding. Caregiver involvement provides essential support for medication adherence and monitoring, particularly for patients with cognitive impairment. Shared decision-making tools facilitate discussions about medication benefits, risks, and alternatives based on patient priorities. Comprehensive medication counseling addresses proper administration, expected effects, potential side effects, and monitoring requirements. Adherence support strategies should be individualized based on patient capabilities, preferences, and available resources. Regular follow-up appointments ensure ongoing monitoring, address concerns, and adjust treatment plans as needed. Group education programs provide peer support and reinforce key concepts about safe medication management. Patient feedback mechanisms ensure continuous improvement in medication management approaches and communication effectiveness.
Continuous quality improvement and ongoing education ensure sustainable improvements in medication management practices. Healthcare professionals must remain current with evolving evidence and best practices in geriatric pharmacotherapy. Successful polypharmacy management represents a cornerstone of comprehensive geriatric care and patient safety.